says cat and mouse games as lawmakers seek to avoid arrest, and that is all that was transpiring. But far from that high drama, there was something else that was transpiring. CS for the Health Ministry, Mutahi Kagwe, was facing the National Assembly Health Committee to answer to questions on how the COVID monies have been used so far, and there was a lot of speculation and media reports that there has been some misuse of said funds. So he did show up, and one of the concerns that was raised by one of the members of parliament here, I'll just read something that one of the questions he asked, that is Mary North MP Muriuki Njagagwa, who says so many people cannot afford masks when KEMSA is just sitting on millions. Vulnerable Kenyans are on a daily basis forced to make a decision on whether to buy food or masks. And this is a very valid concern right there. And he did address it, saying that the procurement of said masks was underway. What do you think of this one, Mr. Osido?
I agree, because it is not fair for Kenyans to be given the option between safety and security with regards to healthcare and then their own food, and of course food and health. So it really is incumbent upon the Cabinet Secretary, the Minister of Health, and all the officials, the entire team that is involved in this particular process, to be accountable to Kenyans. And Trix, you remember that many times yourself, Michael, and I, and several other speakers have really come out to be able to ask the ministry to ensure that they have very stiff measures of accountability, and even open these processes for institutions and organizations whose interest is in healthcare and accountability and good governance, like County Governance Watch. There are networks of civil society organizations and even faith-based organizations, and many Kenyans whose interest is in healthcare, and particularly because COVID-19 is such a global pandemic that has changed the way we live our lives. And so this is an issue that cannot be run in a silo, that has in a manner in which it is seen to be protected for a few people. So we have said in the past that every evening, the same way they give us reports and records of how many Kenyans are infected, how many of us are being hit by God, and how many of us are succumbing, the same manner is the same way they should also be able to set aside a time to be able to share with Kenyans how the COVID-19 resources are being utilized. Otherwise, I am afraid that over time we'll be having all these reports being put out there, but nothing is being done. Why? Because we have come through this process. We have seen this kind of occurrences in the past. Kenyans come out, sometimes they even go to the streets and demonstrate. We have very many exposures that are done, but unfortunately, government many times does nothing. Institutions that have been given the power to be able to investigate and to be able to ensure that culprits are arrested and put to task to answer questions, those institutions now need to come out very strongly to be able to ensure that Kenyans are not being given a raw deal, because it is true, Kenyans are buying masks. We were told that every day we'll be getting masks from Kikotech, and that there are going to be production of massive numbers of masks. Personally, I have asked people in various platforms to show how many masks or government deliveries they have seen being done. It's very minimal trips. So I think that of course, I have to applaud the Senate for calling upon the CS and his team to be able to answer questions, but those questions also need to be opened up to the general public, so that every time it doesn't have to be people being called to answer questions. They should be able to see it as a responsibility and as an opportunity that Kenyans have given them to serve them, and that when Kenyans feel that there is something which is not properly being done, let accountability take its course. Let them open up spaces for monitoring. Let's see tendering being done openly, the same way we see.
Mr. Osido, one would hope that the members of parliament who are meant to represent the people are doing this sufficiently. As the article puts it, Ndiwa, Member of Parliament Martin Owino, did point out to the fact that taxpayers are not getting value for their buck, because this or what is due to them. And we had the CS dismissing claims, terming them fiction, because there were people asserting that the Jack Ma donations of masks were being sold off in Tanzania. Do you think corruption is so deeply rooted in our society that even when things are going on the right way, we just tend not to believe it? What do you think about perceptions versus reality? Because he kept knocking off all these accusations that had been leveled against the ministry.
Yeah, but Trix, that's good. However, the only way to knock out perceptions and assumptions and suspicion is to provide evidence.
Yeah.
Because you remember that, of course, the media has also been very strong, and Kenyans, through the things that we do every day, we can also be able to pick out suspicious occurrences and suspicious activities going on. So if somebody actually sees masks disappearing, you will say it. And in the era of social media and very strong internet connectivity, with high levels of interest in what is happening with COVID-19, if somebody sees something suspicious, they will automatically ask questions about it. And if they cannot be able to ask those questions, they will post it on Twitter and people will begin to have conversations around it. So it is therefore incumbent upon the cabinet secretary and his team to show evidence. Rushing to brush out what people think and perceive to have happened or is happening is not the best way to deal with it. Why? Because we are living in a society, and this society is not a vacuum. People look at us from what we do, and then they can be able to make a judgment. So I think that the CS has been a good man. He's trained me in governance in the past through a course which is called Political Leadership and Governance Program. And he turns out to be a gentleman who is very pro-transparency, pro-accountability. And so now that he's been given the biggest task, let him actually be able to come out and show that the things he is saying, he is also actually doing them. Otherwise, sitting and saying, we just brush them off like that, I don't think is the best way. Why? Because Kenyans have been asking again, where are these Jack Ma donations? They are not in Kenya. And if they can be able to be spotted in Tanzania, then let's be told how they got to Tanzania, so that then we can be able to have a better way of dealing with our issues internally. But I think the bottom line is to open governance, make governance open to the people. When these things come up, invite people, maybe as observers, to also come and see how they are being received. Let people be part and parcel of that convoy that is transporting them to the storage facilities. When they are being picked, let people be able to sign that Kevin Osido picked 200 million masks and he picked 500 liters of sanitizer, so that when we go back to documentation, we can actually be able to follow track. And that tracking facility, or the tracking process, then becomes evidence for which I expected and still expect that is what the cabinet secretary would carry to National Assembly and to Senate or to Parliament, and show them that this is how we are actually managing this process and its deliverables.
Okay, and speaking of COVID-19 and possible corruption, in Siaya County, Governor Colonel Rasanga had to clear the air after MCAs put him to task to explain where the money that had been allocated to the health ministry at the local level, or rather the health department in the financial year of 2020 had been used. He confirmed that then his administration had received 97 million to build a facility that would help in treatment of COVID-19 patients. And you do know that Siaya County has come under scrutiny for not being the most prepared of counties. Do you think this is the way to go in terms of ensuring that we keep accountability when it comes to COVID-19 and all this money that is being distributed at the local level?
Tricks, the best way, and I have to applaud the various county assemblies and the MCAs for the work that they are doing to be able to put to task various county governments. Because if we are not going to be very careful around how COVID resources are being used, then this is going to be a conduit, a very big conduit of corruption. And so therefore, it means that for instance, the governor of Siaya County, we have hosted him as County Governance Watch to share what he is doing and how he's engaging with the county assemblies. And he was very able to elaborately explain his relationship between the executive and the county assembly. That really needs to be focused, so that then people are assured around how resources are being utilized in the counties. And remember that if we're not going to be very categorical around public expenditure management and the process of public expenditure in terms of engaging with COVID-19 resources, then people are going to be stealing this money and putting it into COVID, whereas they're using money which they are stealing to do other things. So what it therefore means for me is that county assemblies really need to be very strong, and that most of these conversations, in fact, even if they can be open to the public so that people come into the galleries and just sit and listen to how county assemblies are having conversations and discussions around how county governments are using COVID-19 resources. If we fail to do that, then we will be looking forward to the controller, the Auditor General, to raise questions for which things will have already been spent, monies will have already been stolen, and we'll be going back to be looking for resources to be able to respond to citizen needs when those resources will already have been utilized for other things. So I have to, again, congratulate county assemblies like Siaya, but we hope that those kind of discussions are going to yield some results where monies will actually be stopped, the usage of stolen or monies which are being diverted to the wrong usage will be stopped, we'll be able to see clear documentation and conversations around how resources that are supposed to safeguard citizens, particularly during COVID-19 process, are actually being used. So much such that if we say that we are going to supply sanitizers to citizens, let that be done. If we say we are going to purchase masks to give them to citizens, let that be done. The biggest gun to the war on COVID-19 is water. Most citizens are still asking for water, and that water is not being delivered. Why is that happening? Whereas we have enormous resources to ensure that citizens actually are safeguarded against COVID-19. I think that we need to strengthen accountability, particularly when dealing with COVID-19 resources. And if we are going to be again interrogating the budgets, let that also be opened up to the citizens. I think for me today is about citizen engagement and citizen involvement in resources that are supposed to be used for COVID-19. And if that is what is happening in Siaya, let other county governments and county assemblies pick it up, and we hope that they're not just conversations that are taking place, but that the evidence and the results of those conversations will be able to be seen by the citizens to have been used to safeguard their interests.
Okay, and on in the Daily Nation, we still have very many stories centered around COVID-19, how it's impacting local communities. We're told about elderly in battle against stigma and COVID-19. At the same time, on page 8 of the Daily Nation, we're told COVID takes a toll on health workers as 16 dead and 838 sick, quite a huge number, and we're told these figures are spread across 34 counties. 429 is the number of health workers who have tested positive by July the 15th. Pretty worrying trend right there, because these are the people that are tasked with ensuring that we are safe and treated and well taken care of when we test positive for COVID-19. What do you make of this, given that they continue to ask for risk allowance, for more protective equipment and all those things that would help them and create a barrier between them and the virus?
Quite unfortunate, very disturbing, particularly because these are our frontline healthcare workers. These are the people who are right at the center of where COVID-19 is being fought. It's like sending the defense forces, the defense service into a war zone, and you fail to give them the artillery which they require to be able to fight the enemy. And I think that that is what the government has been talking about, and many county governments, the healthcare workers have been on media and have been almost everywhere, sharing how their colleagues are succumbing to COVID-19, how they are getting infected and of course affected. So because mentally speaking, you therefore cannot be able to effectively deliver. It should be really a sign and a pointer to our government to be able to consider how we prioritize on our issues. If we are going to deal with COVID-19, there are basic things which we really have to do. And part of that is the provision of PPEs,
yes.
Public personal protective equipment or devices to our frontline healthcare workers. If we will wait for them to really, against all the monies that we are being told is being stolen, I don't think it is being done in good faith, and it's not showing a lot of goodwill from government to be able to safeguard the interest of our frontline frontline defenders. Second to that is what you mentioned, which is really allowances and just what they need for peace of mind to be able to deliver. It would not be fair for even resources to be stolen when healthcare workers are still asking for allowances. Let conversations take place. I think the biggest issue is let Kenyans learn to speak to each other. Salaries and Remuneration Commission SRC needs to sit with county governments or council of governors and agree on how allowances are going to be graded so that healthcare workers can actually be given what they need. And more pressure needs to be put to Treasury through the COG or through various institutions. I'm sure that KMPDU, they've done their work. The National Union of Nurses have done their work. Many other networks of healthcare, of health sector interest organizations have also come up to really speak about how government needs to prioritize on our healthcare workers. Why? Because these are our frontline defenders. And if we are going to, again, I repeat, send our defense forces to the war zone and fail to give them what they need to fight this war, they are going to be swept across. And once that first line of sweeping is complete, they will move into sweeping almost everybody. And that is what COVID may do, God forbid, to Kenyans. If we don't give a lot of emphasis to taking care of our healthcare workers, then what we are saying is we are opening doors for this virus to be able to come and affect us, which I don't think is what Kenyans are expecting from our government. So let conversations take place. Let's not see nurses and doctors going to the streets to demonstrate for them to get what they are asking for. Let people learn to speak to each other. And by speaking, I am convinced that we'll be able to have solutions that even when we disagree, but we can actually arrive at a compromise on how far we can be able to go into meeting the ends and the bargains of either sides.
Right, and we have the talk and the speaking has been done so many times, Kevin. We have a quote here from the Kenya National Union chairperson, Union of Nurses chairperson of Lamu, who has said right here that despite our efforts to push for safe working environment, nothing has been done. He does said that the equipment that was imported was substandard and basically put them at risk. In Kisumu, the same union's chair, Maurice Opetu, said the PPEs were substandard as well. So this is, I think, maybe going beyond communication and talk, because they have voiced their opinions on this several times, but nothing much is being done. And then we are having a situation where, as far from that, also in local communities, we're having a situation where stigma is another problem. What do you think needs to be done to ensure that old people, particularly who are very vulnerable, who have gotten this virus, maybe treated and discharged, are not facing the kind of isolation that one Bernard Ndege is facing, according to the story in page 9?
So two things. One, on substandard PPEs, I think the law, we've always said the law is very clear. So we have procurement processes, very strong procurement laws that are supposed to safeguard how we do our business within the borders of Kenya. If somebody procures substandard equipment, really, there's a problem, either a mental issue or somebody who is not just concerned about the interest of the people who are going to use those equipment. And really, those are going to be our frontline healthcare workers in the war against COVID-19. Let the people who signed, again, remember we said earlier on, documentation as evidence, as evidence. Those who took part in the procurement of this particular kind of equipment need to be put to task. Let them be brought to book so that they can be able to respond to how much that was able to be done. And then secondly to that is, remember that COVID-19 is not waiting for us to also follow the process and the procedure. I think Kenyans, we just need to be people who can be trusted, and people who can be who can be seen to be doing what we are expected to do without expecting anything much. Because sometimes you do things not because of what you can get, but because of what you are expected to do, and then the results of the work which you are supposed to do. So I think it's important that we stop putting the lives of our healthcare workers at risk. And because, yes, you're right in saying that they have complained and talked about this, we have institutions, tricks. If we can be able to write petitions and memoranda documents, and we have laws that safeguard how citizens engage with the citizens, with their governments, and particularly because these are organized networks, like Kenya National Union of Nurses is an organized network that cannot be ignored. Let them put these things in writing and ensure that follow-up is done. And if answers is not given, then we take people to court and push the court to ensure that they answer to questions which citizens are asking and they're not getting the answers.
Absolutely.
On the issue of stigma,
Yeah.
very disturbing. It really comes down to how we are communicating even among ourselves as citizens, how we are creating awareness. And I believe and government has not done very well in terms of awareness creation when it comes to COVID-19 and stigma. A lot of conversations and talk is taking place around mental health, but I think that needs to be moved from a very professional, high-level conversation into the community, citizen-driven conversations. And at that level, we have community health volunteers, we have community healthcare workers, we have institutions of national government administrative offices, the NGAOs, that can be empowered to be able to help Kenyans understand how to live with people who are elderly and have also gone through a recovery process of COVID-19. And if that can be done, tricks, then we'll be giving a safe space for people who have gone through this particular experience and are elderly an opportunity to share, or will be empowering people who can be able to have conversations with them. Stigma is real on any parameters, not just for COVID-19. And I think that how we have been able to deal with it when it comes to relating it with other infections and other situations like HIV, AIDS, for example, tuberculosis and several others, the lessons that we have learned from those processes now need to guide how we engage even with COVID-19. And a lot of work goes back again to the Minister of Health and how it engages with other institutions of government and citizen-driven networks at that community village level, because the elders are right in the communities. They need people who are close to them, people that they can be able to trust, and people who can also be able to share with them communication and information around COVID-19 so that they're not seen to be neglected. They're being told stay indoors, don't walk. And if you tell them that way and every other person is getting out there and walking, and when they come back home, they're not giving them an opportunity to also be heard or share their experiences, then of course they are going to get stigmatized, and over time, may God help us that, but we may have as many people getting succumbing to COVID-19, not necessarily because of the infection, but because of the manner in which we are relating with them.
Things. And thank you very much for that in-depth analysis of that. We're going to take a short break. Remember to be a part of the conversation.